Hi, everyone, and welcome back to Health First. Today I'm here with Dr. Jamison, who is an emergency medicine physician. Hi, how are you?
Hi, Emily. Thanks for having me.
Of course, thank you so much for joining me here today.
Of
I would like
course.
to start off by asking what influenced you to go into the medical field?
Well, to be honest, that's a hard question for me to answer. My father tells me that when I was 3, that was the first time I said that I wanted to be a doctor. So I really don't remember if there was one thing that I saw or read, or I don't know, maybe an episode of Sesame Street that influenced me. But as long as I can remember, I said that I wanted to be a doctor. So it's just something that I've always known that I wanted to do. So it's yeah, I think it was just kind of like my calling.
Yeah, I'm exactly the same way, actually.
Yeah.
And you work in emergency medicine. So, why did you choose this specialty?
So emergency medicine, for those who don't know, is a specialty that has a very wide range. Most people know it as doctors who work in the emergency room, which is, I guess, the bread and butter of what we do. But we also extend other places. So doctors who work in urgent cares, for example, those are usually emergency medicine trained physicians. We also do lots of other types of medicine, wilderness medicine, toxicology, ultrasound. We do lots of different disciplines of medicine within medicine. And so I think that in and of itself was one of the reasons why I chose to go into emergency medicine, because I like the variety that comes along with it. I like the range that emergency medicine carries with it. I remember uh, as I got closer to going into um, medicine and going into into medical school, and wanting to make the decision about the specialty that I would go into, and just knowing that, it didn't really appeal to me to look at the same thing all day long. I liked the variety that emergency medicine provided, and so that was a very, very big part of what influenced me to choose that as a specialty.
Yeah, I didn't even know that there was such a variety to it. And can you tell me a little about your profession and what you do?
Right. So I work in a hospital in the Bronx. And for those who don't know, just to give you, I guess, the progression of going from a student, let's say, to a doctor, you usually will finish high school and then college, and then you go to medical school. Once you finish medical school, you are technically a doctor. You have your medical degree, but then after medical school, you have to go into residency. And residency is the time of training that you will learn how to work in the specialty that you choose. So the specialty that I chose, being emergency medicine, I did an emergency medicine residency. Once you graduate from residency, you become an attending in that specialty. So I'm currently an emergency medicine attending, and I work in a hospital that has an emergency medicine residency program. So not only am I a physician who sees and treats patients, but I'm also a faculty member within the residency program that's in my emergency department. So medicine has again, a lot of range. It's not all just seeing and treating patients, which is, of course, why we go into it. But in terms of what it is that I do, like I said, I see and treat patients with emergent conditions, strokes, heart attacks, stab wounds, gunshot wounds, all the things you see on TV. But then also, like I said, there is an academic side as well, where I am a faculty member who teaches residents who are training in emergency medicine how to be emergency medicine attendings and physicians later on.
Yeah, that's amazing. And what do you like most about your profession?
I like I like the range. I like the variety that it provides. So every shift is different. You never go in knowing exactly what your day will be. There are many times that you go into a shift and it's just like crazy. There are tons of patients there. It's very busy. It's very stressful. It's very high energy. And then you give it like an hour or two, and then all of a sudden it's just totally quiet. The opposite happens all the time as well, where you walk and you're like, oh, this is going to be a nice calm day, and then just out of nowhere, boom, everything just blows up there are lots of patients coming in, lots of emergencies, very fast paced, having to think quickly on your feet. So I like that. I like that no shift is the same. I like, again, seeing the variety of pathology or problems in the emergency room that I do. I love that I can see um, in one shift. I've seen a baby be born and unfortunately an older person die, you know, in the same 12-hour shift. So just kind of seeing the range of what happens in a person's life, kind of having a front seat to that human experience is something that is one of the most satisfying parts of my job.
Yeah. And as you know, the COVID pandemic has greatly affected the nation and continues to do so. So, how is it like working throughout the global pandemic?
Well, like I mentioned before, I work in a hospital in the Bronx, in New York City, and so New York was one of the first states that was hit the hardest at the beginning of the pandemic. And so, just to give a little background, when the pandemic first started, or when it really hit New York, I actually was out of the country. I was celebrating my birthday, which is in February, the end of February. I was in Dubai for about a week and a half. And I remember seeing everything on the news and like hearing about everything, but I wasn't in it. So I didn't know the severity of what was going on. I was hearing, oh, it's just like the flu. I remember learning about coronavirus in medical school. So I remember thinking, well, why are we so panicked about something that has been around for so long? And I will never forget my first shift in the emergency room back from vacation. It was like a completely different world. You know, all of the hospital staff, we were wearing tons of PPE. We were wearing, you know, the gowns, the N95 masks, the face shields, the hair nets, I mean, just you name it, we were wearing it. And I remember coming in and finding out about a 40-year-old man who was on a ventilator because of being infected with COVID. And that was when I realized, like, oh my goodness, like this is much more serious than what has been presented on the news. Because at that time, they really were saying, oh, it like affects older people, it affects people who have medical problems already. But this was a young, healthy person who had no reason to be as sick as he was. So just to fast forward the entire time, I would say this the spring into into early summer of 2020 was when we were the busiest with the pandemic, and I'll say it was an experience that I never imagined, and I'd never seen anything like it before, and I hope that I never see anything like it again. I cannot put into words the devastation that we saw every single day, shift after shift after shift. You know, I don't want to get too graphic on the interview, but I will say the number of deaths that we saw, that I saw personally in one shift, or each shift, was, like I said, something that I'd never experienced, and I pray I never have to again. It was devastating. It was absolutely devastating, and it took a lot of not only physical toughness but mental toughness to be able to really work in those conditions. I took for granted how uncomfortable all of the PPE is that we had to wear. I'm not used to having to sit for 12 hours straight wearing mask, gown, face shield. I mean, it was just so physically uncomfortable, but then also the mental toughness of having to work closely with patients in an environment where you yourself are now afraid of, to be honest, of being infected with something where there are not really lots of treatments, or the treatments that were available were unknown. Um, you know, like I said, I've never been at work afraid for my own safety, for my own health, for the safety and health of my family members. What am I taking out into the community when I come back home, when I go to the grocery store? You know, that was something that I've never had to deal with. That was very, very difficult to have to deal with, like I said. And so without rambling, in a nutshell, it was very difficult.
Yeah. It was very devastating. And like, even I, who wasn't like working or whatever, like, I felt also like it was very hard, like, difficult time for everyone.
Right.
And now there's vaccines out. So, what is your outlook on the vaccine? Do you believe it is like making a big impact, and are you for it?
I am absolutely for the vaccine. I was able to get my vaccine back in December of 2020 when they first brought it to the U.S. and they made it available to healthcare workers primarily. So yes, I've been vaccinated since December, and I think it is it's a wonderful offering of scientific ingenuity. I think that because of the fact that the pandemic had such devastating impact on our lifestyle, everything from having to stay home from school and work and having to wear masks out in public and around friends and family, the vaccine um, has been a way that we can try to resume our normal lives. I know that there's lots of controversy surrounding it, and I think, unfortunately, a lot of the misinformation that has been circulating about COVID, its transmission, and the vaccine as well has contributed to a lot of, as I mentioned, the controversy surrounding it. I really would love, and I know it's idealistic. I think it's wishful thinking, but I would really love to see um, the nation kind of just get on the same page in terms of what our goals are and in terms of what it is that we see for ourselves, that we want for ourselves. If we want to get back to our lives as we knew it before, it really would be best to trust the experts, trust the scientists, and trust those who have dedicated their entire lives to understand and learn these disciplines to guide us correctly. One thing that I tell people is that as much as medicine and science, no, it's not perfect. Um, yes, we all are learning kind of as we go, but for the most part, what should be remembered is that, as I mentioned, scientists, doctors, nurses, we've given our entire lives to learn how to take care of people. We've given our entire lives to learn how to study our given subject or specialty. And so I think the mistrust of people who have given their entire lives to learn something to take care of people. In some instances, I do understand it. In some instances, I do believe that the skepticism may be justified. But at the end of the day, for the sake of getting on the common goal, I do think that we should trust the experts and trust that their life's work is being done to help and not to harm us.
Yeah. And to end off, can you give a few words of advice to the people of my generation hoping to go into the medical field?
Oh, absolutely. So, with the medical field or any scientific field, I'll say it is a lot of work. It does take a lot of time. It takes a lot of dedication. It takes a lot of mental toughness. It takes a lot of sacrifice, but it is absolutely worth it. I think that one thing that I know that people say, especially young people who would like to go into whatever field it is that requires any level of training or like years and years of school, they all say, "Oh, well, it's going to take so long. It'll take 10 years. It'll take 15 years." My advice is, or my answer to that is that no matter how long it takes, God willing, the time will go by anyway. Whether or not you're working toward your goal, 10 years will pass. So, you might as well spend those 10 years working on your goal, because when 10 years is over, you'll have the degree that you want, the job that you want, the goal that you wanted to achieve, you would have achieved it, as opposed to becoming or getting intimidated by the time, not doing anything with it, and then letting the time go past, which it will, no matter what you decide to do or not. So that's my advice. Don't let the time commitment be too much of a deterrent, because, as I mentioned, time will go no matter what.
Yeah, thank you so much. And thank you for joining me. And thank you for your time.
No problem. Thanks for having me. I had a great time speaking with you, Emily. This is wonderful what you're doing.
Thank you so much. Have a great day.